Hello.
How are you today?
I'm fine. How are you?
Doing well. Today I'd like to talk about when birth doesn't go as planned. I know all these other prenatals, we've been talking about how to set yourself up for the birth that you want. But today I'd like to talk about if the birth doesn't go as planned, how to facilitate a successful transfer. How does that sound?
Sounds good.
Great. There's a handout that you will be getting that you can take home that will go over everything that we're talking about, so don't feel like you have to memorize everything. So one of the main things I want you to know is that typically transfers are non-emergent. It's like a conversation that happens between us. There might be different indications that come up that we talk through, but if we transfer, it's typically both of us coming together and deciding that's the best thing to do. It doesn't just happen all at once, normally. Do you have any questions so far?
Nope, no questions.
Okay. So if we were to transfer, there are times when we could drive to the hospital, or you could drive to the hospital with your partner, or we could call the EMS for transport, depending on what's going on and what's the best in the situation. I can become the doula at the hospital for you unless you have someone else that you would like to take on that doula role at the hospital. Do you have any preferences or anyone in mind?
No, I think you're just great.
Wonderful. Do you have a hospital in mind that you would prefer? There's St. Luke's, there's Essentia, there's Cloquet Memorial Hospital.
St. Luke's sounds good.
St. Luke's, excellent. I will circle that. Anything coming to mind yet that you'd like to chat about?
No.
Okay.
Thanks for asking.
Well, a few reasons why a transfer could happen would be like in pregnancy, say there are health issues that come up for you that I can't facilitate you taking care of with you, or I can't help you take care of. There we go. This could be a situation where there's co-care with a provider at the hospital and with me, or it could be a situation where it just becomes hospital care. But it's totally dependent on each situation. If there were fetal abnormalities where there would need to be medical attention after birth, then a hospital would be a safe option. Say in labor, maternal exhaustion is one of the most common reasons for transfer, typically non-emergency. Typically it's to go get an epidural and relax, and then a lot of people can still go on and have a vaginal birth. To help you not have maternal exhaustion, do you remember what you do?
Eat and drink.
Yes.
And go potty.
Eat, drink, pee, and rest. A lot, especially in early labor, especially since it's your first labor. Remember? Another reason would be maternal fever. Anything that indicates an infection. And these are things that I watch for, not that you have to watch for. Like, this is my job, is to know what normal is, so I know when it's not normal, and that way I can either help it get to normal or figure out our next action. So after birth, some reasons why we might go, say there's excessive bleeding that we're unable to manage at home. If there happens to be a tear that needs to get sutured, we would go in for that as well. Luckily at home, we don't see a lot of tearing because people are more relaxed. So.
That makes sense.
And then reasons we transfer a newborn after birth. And I want to point out Essentia is the only hospital here that has an NICU. Beyond Essentia, it would be down in Minneapolis. But if we were transferring for you, you could still have St. Luke's. Whereas if we were transferring for your baby, it would have to be Essentia. Does that make sense?
Totally.
Okay. So for a newborn, if their temp is too low, like less than 97, or too high, like over 104, then we want to go get that checked out. If they have jaundice right at birth, or within the first 24 hours, we'd want to get that checked out. But it's completely normal to have jaundice later on. Just we don't want it before the 24-hour mark. And if there are breathing issues that we're unable to resolve. But I'd like to throw out that some infants need help. When they come out, they just need help clearing their lungs because the lungs are fluid filled. And then that fluid has to kind of get pushed out of their lungs. And sometimes they might be tired from the labor and they might have trouble clearing that themselves. So we can give them a few inflation breaths. And that's something you could do. I could help instruct you, or I could do it.
Okay.
And if you have more questions about that, we can definitely go over it together sometime. So, you see I made this little dialogue. This is what you'll go home with. And it tells you exactly what to do for calling EMS. It would not be you calling, typically. It'd be me or your partner or my assistant. And we just dial 911. And then we say, we need a lock and load at, and here's where we'll write your address, because sometimes when people are all amped up, they can't think very well. So it's just easier if it's all written out here. So when you have your sheet, I'd like you to fill in your address. And then we say, we need a transport for, and then I have these different options: mama in labor, postpartum mama, newborn. And then due to, and it's okay if we don't give them the answer for this. Say whoever's calling doesn't know. It's okay. Or we can share that with them. And then we say, is the rig on the way? Because we really want to let them know, come now. Otherwise we wouldn't be calling you. Possibly there are special instructions, like say maybe you have a door that looks like a door on the outside, but it's not actually a usable door. You wouldn't want them to park at that door. So if there are special instructions, you can put that in here.
Okay.
If we're not utilizing EMS, I or the assistant will call the hospital and let them know that we're coming. So it's not a surprise. Do you have any questions about transport so far?
Nope, no questions.
Is this bringing up anything for you? I know it's kind of a heavy topic. How are you feeling?
I think I'm okay. Thanks for asking.
Great. I'd like to share a little technique with you called the butterfly hug. And this is a way to help settle our nervous system after talking about such a kind of intense topic, really. And also it's something you could do if we did need to transport. You could do this on the way to the hospital. So we have our hands like so, crossed over, fingers just underneath the clavicle. And they're just like little butterfly wings. One comes up and then the other. And you just notice your breath. How does that feel?
Feels calming.
Great. And you can do this anytime. It's a great little technique to even eventually teach to your children.
Can you move that independent of your breathing, or do you try to synchronize?
It's up to you. I don't think about it. I just move my hands and breathe. But you do what works for you. And if you can't get your hands in this position, you could use your arms as well. And say you can't even do that, you could use your legs if you need to. Like, it is flexible.
Okay.
Well, I am really glad that we got together today and had this talk.
Me too. Thank you.
And I'll see you in 2 weeks.
Okay.